So we'll wait for a few minutes before someone joins. So welcome to Instagram and YouTube live session. Dr. Janvi, Dr. Mohit, with Vidya, Dr. Vidya, yes, if I correctly pronounced your name. So it is a session to answer your fever related questions. Fever questions answered. This is what I have kept the name of the session. So I received a few questions from the audience. In the story, the question box has been put up. So the first question was what to do in cases of children where no symptoms are shared by the children. So there will be something that you will be able to observe. Number one. Number two, there is a guardian of the patient or the parent who will tell you something about the changes in the behavior of the child that you can rely on. Number three, is there any functional disturbance or pathological disturbance? You have to analyze, and then you will be able to understand whether you need to give XYZ medicine or any other medicine. What medicine to give will depend entirely on these three things that I have shared: observation, details from the parents, and whether the case is functional or pathological. There are many little things like how to take a case in such a scenario that will be covered in the workshop. Everything can't be shared in an Instagram live or a YouTube live. And for this specifically, I have designed this workshop that is named as the Fever Workshop, which begins on 15th August. So that was the first question that someone asked, and I chose to answer how to take children's cases in fevers, or how to take a case of a child when he's not sharing anything. So that is the three things that I wish to share. The second question which someone asked me at 5:15 Instagram live, which was on the Ellen's keynotes, Thuja. So someone asked me that whether there is any uh, symptoms of Thuja in fever. Every remedy has symptoms in fever. You will have to understand when to prescribe Thuja. It is an intercurrent remedy and it can also be employed in mainstream fevers. What will be the mainstream fever that you will apply the Thuja remedy for? That will be discussed in the workshop, because it's a part of workshop. It's an intercurrent remedy, it's a full-fledged constitutional remedy. There will be cases where you will need to employ this medicine solely without giving any other medicine. So in this way, you can think of prescribing Thuja as a remedy. So Dr. Somesh Mithun, glad to see you. Dr. Shailendra, glad to see you. Dhan Meher and few other people who have joined. If you have any questions related to fever, I'm there to answer. Please feel free to drop your message, and I will answer best from my capacity and my experience of dealing with fevers. And those who are new and wish to know about why this session is being done, it is done primarily as a precursor for you to understand that dealing fevers in homeopathic practice is a challenge, and for you all to understand fevers as an easy going pathology to deal with in clinic, I have designed this workshop, the Fever Workshop, which is scheduled to start from 15th August, and you can be a part of it to understand how things go about. So I hope today I am audible. Someone yesterday told me that I am not audible correctly or there was an issue, but today I put earplugs and I kept it on the desk. So Anyone having any question, there are few viewers on Instagram, few viewers on YouTube. If you feel that there are any questions related to fevers that you are dealing with in clinics, how will you analyze, any remedy to give, any potency, case taking, analysis, rubrics, whatever you feel that comes across to your mind, you can drop in the comments below and I will answer it in the best possible way. One allopathic doctor told just empty sweet pills cures. So I don't know whether you are a homeopath or you are just a layman who has walked in my Instagram live. So I would say that this is purely a science which is based on lot of research already done when technology was not there. So it does work, and for you to believe if it works or not, you need to take the medicine yourself if you are suffering to understand how it works. So Dr. Fit Homeopath, Dr. Asmat have joined. So this is a session purely for homeopathic practitioners who wish to uh, improvise their fever handling capacities in their clinic. And if you have any questions, you can feel free to drop in the comments below about what you think of fevers and how do you want to deal with it in your clinics, and I'll get the best answers from my experience and my knowledge of reading the different literature. Meanwhile, there were 3 questions that few of them asked in the story which I have put. One of the question was how to take a case of child when there are no symptoms told by the child. So there are 3 things that you need to do. One is that you can observe. Second thing is that you can ask the parent or the guardian about what has happened in this phase of fever. And the third thing is whether the case is functional or pathological, because there are remedies which will work on those bases and the potency also. So that was the first question I answered, and the second question I answered was on the remedy Thuja. Someone asked me in my Instagram live today that you talk about Thuja as a remedy in fevers, when to give, what are the symptoms. It's a part of workshop and I cannot spill the beans in the beginning, but Thuja is a remedy we know is a very strong antipsychotic remedy. We give it to patients as an intercurrent. It can also be given as a mainstream remedy. What will be the symptoms of Thuja in the fever cases, fever situations? That will be a part of the workshop. You can understand that. And if any other audience has any other question, you can feel free to ask, or else we make a move so that you can note down your questions, and we meet again tomorrow 9:30 p.m. same time in the evening for 10 minutes, discuss a few things about what are your queries about fevers, and help you understand about how confident you need to be in dealing with fevers, because homeopathic doctors are labeled as just dealing with skin problems, joint problems, chronic pathologies which have been lingering for many months and days. But if you wish to deal with acutes, especially fevers, this workshop which I have designed to start from 15th August, you can find all the details in my Instagram post, in my YouTube community tab. There is a post. There are other shorts, YouTube shorts that you can refer. There is a description mentioned, phone number, email address. You can contact and join my workshop so that your ability to deal with fevers, whether functional or pathological or psychosomatic, are dealt with in better way, and you develop the confidence to deal with them. So that's all from today's session, and Doctor, I have a case of severe osteoarthritis. How to approach? Please drop me a message and we will establish a consultation time to discuss further. So you can drop a message on my profile and on this profile itself on the Instagram, and I'll try my best to set up a time and we can discuss about it. So that's all for today's session, and there will be a recording posted for a few days. You can watch it if you feel like going through it again. There were 3 questions asked and 3 questions answered, so you can go through it, and that's all from me for the moment.